A peripheral blood film, PBF, is a diagnostic tool used to examine the morphology of blood cells. Here's an overview. Purpose: 1. Cellular evaluation, assess the types and morphology of blood cells. 2. Disease diagnosis, aid in diagnosing hematological disorders, infections, and other conditions. Preparation: 1. Blood sampling, a blood sample is collected from a vein. 2. Smear preparation, a thin film of blood is spread on a glass slide. 3. Staining, the film is stained, typically with Romanowski stains e.g., Giemsa or Wright stain. Cellular components: 1. Red blood cells, RBCs evaluate size, shape, color, and inclusions. 2. White blood cells, WBCs assess types, neutrophils, lymphocytes, monocytes, eosinophils, basophils, and morphology. 3. Platelets, evaluate number, size, and morphology. Clinical significance: 1. Anemia diagnosis, assess RBC morphology to diagnose types of anemia. 2. Infection detection, identify WBC abnormalities or parasites, e.g., malaria. 3. Hematological disorders, diagnose conditions like leukemia or lymphoma. Key findings: abnormal cell morphology, variations in size, shape, or staining can indicate specific conditions. Cell counts, estimate WBC or platelet counts. Inclusions or parasites, identify intracellular parasites or abnormal inclusions. Would you like more details on interpreting peripheral blood films or specific conditions diagnosed through PBF?